All right, we're staying with COVID-19 and looking at the big picture. Across the world, the number of reported cases of the coronavirus passing the 10 million milestone today. This is the number of global deaths from the virus approached 500,000. Well, the grim milestone comes as many hard-hit countries ease their lockdown measures whilst making extensive alterations to the way people live and work. North America, Latin America and Europe each account for around 25% of cases, while Asia and the Middle East have around 11% and 9% respectively. Just two countries, India and Brazil, account for over a third of all new cases over the past week. They're both battling outbreaks of over 10,000 cases per day. Brazil reported a record 54,700 new cases on June the 19th. Some researchers predict the death toll in Latin America could rise by over 380,000 by October. Now, as of this morning, there were more than 497,000 fatalities linked to COVID-19 worldwide, so edging ever closer to the 500,000 mark. Some countries are also experiencing a resurgence in infections, leading authorities to partially reinstate lockdown measures. The United States saw cases pass the 2.5 million mark yesterday. Countries including China, New Zealand and Australia have seen new outbreaks over the past month, despite largely quashing local transmission. Well, for more on this global picture, we're now joined by Dr Wilmot James, who is a research scholar at Columbia University in New York, in the United States. Of course, he hails from South Africa. Doctor, thank you for being with us. And let's start where you are in the United States, where infections passed 2.5 million this weekend. That's pretty staggering. 40,000 new infections on one day just recently. Talk us through some of the hotspots in the US that we're seeing right now, and your opinion. Has the US again lost control of this?
Well, first of all, good afternoon to you and to the viewers. And I'm very pleased to be able to talk to you as a fellow South African. So let me just start by saying that the United States never had control over this pandemic because there was no national leadership taken, and they acted way too late. And so to the extent that anybody took any kind of control, it was on the state level, and it started off with New York State being the worst affected. So, but you know, New York is one of 50 states in a very, very large country with a big population. And as we know, pandemic management requires national leadership and national control. And there is no national leadership or national control in the US presently. So the country has stumbled very badly.
Yeah. The president doesn't even wear a mask. So you're saying political leadership is so important. And I mean, talk about Brazil, because they're the top leader again accused of being completely reckless, completely cavalier, and hence the infection rate.
The fundamental point about dealing with a pandemic is that it's a global thing, and therefore it requires strong global leadership. But all health policies are nationally implemented, and so you need strong national leadership. And in federations like the US, like Brazil, like in India, your presidents, if they so choose, can evade responsibility. In the case of the US, Donald Trump has evaded the responsibility and kicked the can down to states. In the case of Brazil, they've done exactly the same thing.
Yeah.
And then in terms of their actual behavior, they just set a very bad example.
In the US, there was optimism a little while ago. I mean, I was following the markets. They were actually rising because of that optimism. But do you think now, looking at this resurgence, that was completely misplaced?
Absolutely misplaced. You must remember, this is a novel virus. It is seeking opportunities all the time to infect. And therefore, if you relax and lower your guard, it will seek out opportunities to infect. So this is not a once-off thing. This pandemic is going to be with us for 3 years at least, and there will be re-emerging of cases. So in the case of the US, they simply opened too early and didn't do the necessary. And we understand why we should open and get the economies going again. But you have to do three fundamental things. You have to test so that you have surveillance systems in place so you know what you're dealing with. You have to socially distance. That's the only tool we have. It's called non-pharmaceutical interventions, which means social distancing, wearing of masks, and practicing very good personal hygiene. You have to do that. And if you can test and at the same time have proper surveillance, at the same time practice social distancing, then you can open in a staged and managed manner.
Yeah.
And if you violate any of those things, you're going to have trouble, as we presently have in the US.
So is that what's happening in many of the states? We hear that Texas, Florida, for example, Arizona, were going to reopen. They're pausing those reopening plans, and I guess looking at the economic cost versus the health cost and whether all these things are in place.
So those are the 3 hotspot states. They've reopened. Younger people have come out during a period of protests that have occurred. And also younger people go to bars and they go to pubs and they go to places where people gather. And they have not observed social distancing. So that's why there's an increasing infection rate among younger people in those hotspots. Now they're trying to pull back, and it's important to pull back. But at the same time, you can't act in isolation. So every U.S. state, again, has to cooperate with every other U.S. state. So it still requires strong national support. So
let's look at Brazil again. 54,700 new cases in a day recently in Brazil, which is higher than in the United States. You spoke about political leadership there. What are the general projections right now for that country?
So what's different about Brazil compared to the US, it has a very large urban population living in slum areas, and its levels of poverty and the access that people have to healthcare and healthcare facilities is nowhere as close as you get in advanced capitalist countries. Brazil shares this with India as well, the same kind of problem. So when that happens, and when you have the kinds of vulnerabilities that Brazil has, in terms of the health profile of the population and also the quality of the health system, and when you have a federation at the same time. What's important, if you look at especially the urban areas, is to have, again, strong national leadership. And you must not have a situation where the president is at war with their states. So presently in the US, that's true, and in Brazil as well. So President Bolsonaro is fighting with his own people at the very time where there has to be absolute unity. We have to have a single, strong national plan. In my view, he's been absolutely reckless, in fact. No proper example to his people, and very, very bad, poor leadership.
Can you comment on the leadership of India? Let's look at the figures. We'll bring those up on the screen. And of course, there's been the same concerns there, the proximity in which people live and the incredible poverty in that country.
Well, it's even worse. Compared to Brazil, you've got a population of 1.35 billion. In the case of India, in Brazil, it's 209 million. So it's a much more populous country, much higher levels of poverty, and massive slums where social distancing is simply physically not possible. So you have that also in the federation, which means that states essentially are taking responsibility for health, and where the health systems are really, really, really not adequate at all. So India is heading towards a massive disaster, as is Brazil, but India's disaster is going to be really catastrophic because you're simply going to see many people die because of those characteristics. So it is of the greatest concern. In addition, India is facing competing catastrophes, natural ones through hurricanes and as well as floods, and you're looking at other infectious disease outbreaks that are occurring simultaneously. We are gravely concerned about where India is heading.
So you're talking about a humanitarian catastrophe in India. Surely that country will need a lot of help at a time when so many other countries who would be there offering that help are already stretched themselves. That's
absolutely true. There's a global competition underway, which is unfortunate when it comes to medical devices and therapies and so on. In the case of India, there's a need for emergency help from the WHO, from the global agencies, from the United Nations, and the others have stepped up to the plate through the World Economic Forum. There's a whole lot of effort right now to make sure that India can get all the help that it can get. So, and we just have to do the best we can under the circumstances.
Can you finally, Doctor, maybe just briefly comment on Beijing, on China? I mean, China seemed to be very good at these very hard lockdowns, not allowing people to leave their buildings. And then again, we saw rising infection rates even there.
Well, as I said earlier, that coronavirus is a really diabolical virus. It will search out opportunities, and you must never lower your guard. And even when you do, you can have further breakdowns. So this is an ongoing battle. China is an authoritarian country. It knows how to impose a lockdown and force people to the extent that it does, and it's done it reasonably well in terms of what's required in terms of public health requirements. So it has that power. So and it also is testing right now. It's testing 1 million people a day, which is really quite extensive. So it has the potential to get this under control. And as I said, it has the ability to do that in a way that other countries often can't. I don't particularly admire some of the political characteristics in terms of its capacity. But in this case, it has the ability to impose lockdowns in a way that other countries can't.
All right, thank you. We appreciate your time tonight, and I know that you're worried about Africa as well. Hopefully we will chat to you again in future. That was Dr. Wilmot James, Senior Research Scholar at Columbia University in New York.